Welcome back to Core Anesthesia. Whether you are a student prepping for tests and boards or a CRNA here to earn CEUs, we are glad you've joined us. For more about us, make sure to check us out on Instagram at Core Anesthesia and online at coreanesthesia.com.
Welcome back to Core Anesthesia. I'm Cole, here with Tanner, and today we're really excited to bring on a guest speaker, Bree Brown, who Tanner is going to introduce here in a moment, but we're going to talk about emotional intelligence, and this is something that we often don't discuss as we're going through our journey to become a nurse anesthetist, and it's something that I think is extremely important, especially in our field. It's something that you can definitely tell when somebody has strong emotional intelligence, whereas when somebody is still learning and building upon that emotional intelligence, because it makes the difference in my mind between somebody that understands the fundamentals of anesthesia and the science behind it versus somebody that can manage a room, can control a room, deal with different people, different personalities. When it comes to emotional intelligence, you can often hear from other staff members that tell you, man, that's an amazing CRNA. And I personally know from an education standpoint that there's nothing that makes them exceptionally better from that standpoint compared to others. But what does make them set apart is their ability to relate with those staff members. And that's where the other interdisciplinary team members associate with that CRNA being an amazing CRNA, because they have that extra layer, emotional intelligence. And so today, after Tanner introduces Bree, we want to really discuss the idea of what is emotional intelligence. How can we apply that to anesthesia? How does that take you from just a quote mediocre CRNA that may have all the fundamentals and science and knowledge to be able to take care of patients, but gives you that extra layer to become an exceptional CRNA?
Awesome. Yeah, we're so excited to have Bree on today. And this is, like Cole said, this is a topic that is so imperative to discuss. And it's something that I think can sometimes be left as an outlier when you're so focused on understanding the neuromuscular junction. Emotional intelligence might not seem like it's something that is first and foremost, but like Cole said, when you're in the OR, this is something that is probably one of the most outstanding characteristics that somebody will notice, somebody will realize, and they'll appreciate. All right, it's my privilege to introduce Bree Brown. We're so grateful to have her on the podcast today, and she is the Chief CRNA of North Texas, which is the largest practice within USAP. She's also the chair of the USAP National Care Team Advisory Committee, which helps drive culture and informs best practices for the over 2,500 CRNAs nationwide. So it is our privilege to have Bree on today, and we're really excited for this talk.
Absolutely. Thank you guys for having me today. I'm so excited to talk about this. I think, just like you said, Cole, this is something that we really don't see taught in schools. And one of the things that I like to do as part of my job is go around and talk to students and talk to schools and see what is it they're maybe missing as part of their didactic or clinical. And I think this is a huge issue that we see. You know, I have kids and I'm trying to teach my kids this early, but I think it's something even more so in our professional life. So thanks for having me today.
I love that you brought up kids, because when I was reviewing this outline, I kept thinking, like, this is what I'm teaching my 2-year-old. Earlier when I'm trying to teach my 2-year-old. And this is something that is, again, I think we take it for granted, but it is so important to be included in our practice. So I guess starting off, what would you say, how would you define emotional intelligence, or where does this all begin when you're looking at, if somebody says, I don't really know what this looks like, maybe I'm trying to be better at this, or I know I need to grow, I guess, like, how do we define it? How do we start this journey, I guess?
Well, so there's 5 things of emotional intelligence: self-awareness, self-control, social awareness, empathy, and then motivation and purpose. And they all kind of fluctuate back and forth, right? But I think the biggest one that I see is social or self-awareness. Self-awareness is the ability to recognize, understand, and also manage your own emotions. I think that's huge. And then another part of that, as far as the social awareness too, is how to recognize, understand, and influence those around you, and especially those that you're leading. And I know Cole brought up being in the operating room. And I think it's so huge to have that ability to really understand what's going on in the room versus just your patient. We see it, I've had lots of opportunities. I've been doing this for 20 years. And one of the best things that one of my preceptors told me when I was in school is, you are, next to the surgeon, the leader of that room. And if you freak out or you cannot do your job when there's an emergency, when you cannot handle things and you let your emotions get a hold of you, you're not able to care for your patients. So that's where I think this is really impactful for our students, especially. But as everyday clinicians, there's going to be things that come up and you want to react and you want to lash out or you want to do something. And you have to take that breath and say, okay, just a minute, let me gather myself and figure out if I do this, this will happen.
That's so good. I was talking to a resident the other day and I said, part of our job is obviously to anesthetize the patient, but then you also have to anesthetize the room sometimes. Like you're controlling the temperature. And at that case, it wasn't going well. And there were some things that were, complicated with different tools that weren't, available. And the surgeon was having a difficult time and the temperature in the room was escalating. And I was just communicating to that resident that like our job, if we have things happening on our end, like we can either fuel into this or we can also help bring this down and be part of the solution. And I think it's interesting you said on the beginning part, the self-awareness part. I think that's something that I might struggle with too, just like taking a step back and really looking at like, how am I playing into these situations?
Absolutely. I think we all do that at points is how do I feel and how are my reactions going to be received? And it's hard to do. That's an uncomfortable spot when you have to think, okay, if I react this way, if I lash out this way, what is the room going to do? What are these people going to follow me into battle? Because some days it's a battle, right? And so are these people going to continue to follow me? And it's really learning. I think the biggest step of self-awareness is when I am put in this position, when I am put in stressful positions, or when somebody lashes out, why is my immediate response to clap back? Maybe they've been having a really bad day. Maybe that surgeon is having a really tough case. We've all been there. Does that say you can lash out? Absolutely not. But how I respond to it and how I respond to that surgeon or the circulator, whoever it is, how my response to their behavior can, like you said, control the room. I can diffuse it or I can pour fuel on the fire and make it really bad. And then everybody in the room is uncomfortable and you're kind of looking at each other like, I wish I wasn't here. And that's not good for patients, right? And that's not good for anybody. I think of it, we have a surgeon that I used to work with. I worked with him forever. And this man, he came in and he helped put in IVs. He would help, if I work in care team, if the anesthesiologist wasn't there, he would come in and help, hold crate order, do whatever. He would prep the patient. People followed him. Like if he wanted to move quicker, it was, yes, sir, we can do it, sir. Versus the surgeon or the circulator that's passive aggressive and throwing instruments and yelling. Nobody wants to deal with that, right? So it's really understanding when I have an issue or when I have a situation, how I respond to that controls the temperature of the room. And I think we've become such a culture where, you're on your phones, interpersonal communication is not there. I can text. I mean, I don't know. You said you have a 2-year-old. I have a 16-year-old. Helping them understand, like if you get a text that just says K, that doesn't mean somebody's mad at you, right? And so we're having to learn some of that and understand that tone, inflection, how you respond, if you respond very loudly versus calmly, all of that people receive and interpret. And so we have to be aware of when I respond some way, my friend over here that's the circulator may receive it in a completely different way. And sometimes that self-reflection is really hard to think, you know what? I probably could have handled that better. Maybe I shouldn't have said it that way. And learning from it. That's the big thing too, right? We can do all the self-reflection you want and look at it and be like, that probably wasn't the best idea, but what are you going to do with that information once you realize that?
I think you hit it on the head, mentioning that it's something you learn. Like not any of us are just born with emotional intelligence. It's something that you learn from mistakes, or you learn from past encounters of you interacting with other people, and you continue to grow and to build yourself with that. And I know we've talked so far about just the environment in the operating room, but it also goes to your relationship with the patient. I mean, most of our relationship with the patient is with them asleep. And so we don't think about that relationship as being something that emotional intelligence would affect. but it's something where they're literally the last thing they see are your eyes as they fall asleep in the operating room, and they're trusting you. And so the few minutes you have with them in the preoperative setting, how you uphold your demeanor, how you talk with them, your tone with them, the speed in which you talk, getting across a confidence to them, but not a cockiness to them. Just that whole relationship side of things that's building second by second, and that those few minutes you have with them plays a huge role into their experience with the anesthetic. And I work a lot in the OB world. So in that case, I tell everybody that comes through, I'm training there, this is a very different type of anesthesia because you have to have emotional intelligence way more than you do down in the operating room, because now there's this aspect of verbal anesthesia that plays into it, because there are so many mothers that'll come back for their second, third, fourth child, and they'll tell me, oh, that one I had with my second kid, an amazing experience with my anesthetist. The first time, horrible. Third time, I'm hoping now is going to be better. And the difference when I hear why that is with them, it's not so much the actual anesthetic, it was the relationship they had with that anesthetist. Did they feel valued? Did they feel understood? Did they feel advocated for? And so I think this is just bigger than how you interact with the circulators and the surgeon and the scrub techs in the operating room, but also the patients themselves.
So I guess let's talk about, for part of the self-awareness, then I think self-awareness, sometimes I can get negative with my self-awareness and be, I can really focus on where I'm coming up short, or if I had an anesthetic that, they woke up in more pain, or I felt like I could have done something differently. So how does that translate with emotional intelligence in terms of understanding yourself, understanding your strengths and weaknesses, and then still having capacity to be confident when you're controlling a room and not overanalyzing yourself?
Well, I think that's great what you said. Your weakness sometimes can be, and I do the same thing. I will think, I shouldn't have said that, and I should have done this. But I think when you have that social awareness of you do know your weaknesses, you don't necessarily dwell on them. In fact, I was listening to something, and they said there was a study done that looked at college students that had high optimism versus high SAT, ACT scores, right? And the students that had a higher optimism score actually did better academically than the ones that had the higher, let's say, intelligence scores. And that's because you have the ability to evaluate a situation and realize this happened right now. What am I going to learn from it? It's like we were talking earlier. It's great to be able to understand these things and reevaluate opportunities and interactions. But what are you going to do with that, right? Because if you don't do anything with it, then you're not going to change how you interact. But knowing that, okay, I could have done this better, or I should have, we, especially students, right? Oh man, I would not go back to being a student for anything right now. Yeah. Like, it's horrible. I shouldn't say horrible. It's stressful, right? Because you don't know how to manage all of this. And as a student, you're going to make mistakes. That's why you have a preceptor there. That's why you have somebody with you and available. You're going to make mistakes, but are you going to dwell on those mistakes and just spiral down? Or are you going to say, okay, next time, if this happens, if I'm in this situation, that I'm going to do X, Y, and Z, and you have a plan. It's just like a difficult airway. I have a plan. And so when you have some of those abilities and that toolkit just in your personal self, you don't tend to spiral. You tend to, okay, this is what I'm going to learn. And all of these, like I said earlier, these all go together, right? Your motivation, your purpose, being able to understand how you're received with other people, right? If you are living your why and understanding why you're doing things, like you were talking about a second ago, how do I interact with patients and how do I make them feel comfortable? Then you're able to take what you're learning and build on it and become a better provider, a better leader, a better coworker, really just better in your dealings with everybody.
I love the optimistic study because I feel like optimism can tie so closely with problem solving. Like you just said, it's like you're here now, this just happened. And if you're optimistic about that situation, you're automatically in problem solving mode. And it's like, okay, maybe I didn't know this was going to happen, but like I can now start figuring out what solutions I can come up with to get through this. And that happens every day in the OR. There's a million things that come up that you hadn't quite planned for. Obviously, we try to do our best, but there is consistently surprises or changes that happen. Your assignment might get changed. You might have something, just get mixed around in the room. You might have different resources available to you, but all of that can either weigh on you, or you can take that with a fresh set of eyes and keep moving through your day. And it's not to say you can't be real about frustrations and real about, things that are disappointing and frustrating. But I think having this confidence and being able to control your emotion, you mentioned the self-control aspect too. It's like, if you can control yourself, that's step one, it feels like, into controlling the room that we've already talked about. I know we talked about self-awareness. Moving on to self-control, when you're talking about, different frustrations in the operating room or things that, are weighing on you, is it just kind of like a grin and bear it type of self-control? Or is there, do you have advice to people that, to be able to manage those things that will come up? Obviously, we have all worked in the OR. There's going to be things that come up that require you to check yourself and check how you respond. So what advice would you give to somebody that is dealing with a frustrating situation?
So it's kind of the same thing I tell my kids, right? And I try to practice myself. Take a breath, take a step back, right? When you're about to send that email that is just scathing, sleep on it. Take a minute. It's really, and because we're all like that. We want to protect ourselves. We want to stand up for ourselves. Take a step back. If you're in the OR and it's a really difficult situation, and you can call a coworker and say, hey, I need just a quick break. Let me step out. And then there's always things that are happening in the OR. You deal with it and you have to get over it. But then let's say you have somebody that's yelling at you, or somebody that's being passive aggressive. Maybe you step out after the patient is taken care of, right? Because that's our number one priority. And go to them later and say, hey, can we talk about this? Maybe what I said you misconstrued, because we all do that. I didn't mean to yell at you, or I didn't mean to say it that way. I'm sorry that it was interpreted that way. I can work better. So a lot of times it's just stepping back and thinking, okay, let me give it a second. Let me look at it. And it goes with the empathy side, right? If I said this and somebody said this to me this way, how would I feel about that? I might be a little offended too, and I might snap back. So it's very much, these all go hand in hand as far as they all flow into each other. You can't have self-awareness and self-control and even social awareness without having a little empathy and thinking, if I acted like this, how would they perceive it? Or how does that work both ways? I think so many times we think they did this to me and they said this and they did that and they did that. And sometimes we have to stop and say, okay, what was my part in it? There's always two parts into every interaction. There's always two parts in how people interact. And your paradigm is not what somebody else's paradigm is. And you aren't raised the same, because of how we were raised and on the situations we've been in, that really affects how we respond. And so when we have that, you got to kind of take a step back and say, okay, how does this work? I had a son that was in the NICU, and we had some things that happened, and I have learned very much, just like you were saying, Cole, about how do I interact with patients, right? And it's about, how is what I'm saying and what I'm doing being perceived? Am I clear in my expectations? Am I clear in my communication? And we have to do that throughout anything we do in the ORs. You have to say, I need this, or this isn't going well. And if you expect people to read your mind or just understand what you're feeling, then you can have that miscommunications. And it's not a bad thing to follow up on those things or say, hey, is there something we could do to work better together?
Yeah, a few things I want to pull back on from that. So the first was just when you made the example of waiting a night to send an email. Like, I can't tell you how many times in my life that, like, you go back and you look at things later. If you wait to respond right away, right, even 24 hours, sometimes even 8 hours, I'm like, oh, I would respond a completely different way now than if I just would have hashed out and responded right away, which tells me something. It tells me I need to do a better job of that self-control, of waiting to just emotionally respond to something versus logically and appropriately respond to something. So I love that example because I could relate to that 100% multiple times in my life. And I think that's where a lot of things escalate, especially in the operating room, because typically when things get heated or the temperature rises in the operating room, it's when you're in this already stressful situation. and somebody says something that's interpreted wrongly to somebody else, and rather than take a moment to, again, the second thing I wanted to touch on, you said, put themselves in the other person's shoes, they then just immediately respond to something else, which then in turn causes the other person to say something back, and you continue this spiral into somewhere that never would have gone somewhere if that first response would have been approached differently. With that being said, things do happen quickly in the OR, and you don't always have 8 hours to wait to respond to something. And so the ability to have self-control in the moment is something that I think is it's not an innate thing. It's something that you have to learn. You strive to become more emotionally intelligent. And this emotional intelligence is really self-driven. It's the self-control. That's why I think it's such an important part to talk about, is the ability not just to sleep on it and wake up the next morning, but how do you respond in the moment with conversations in a way that's not an emotional response right away, but an actual level-headed response.
Absolutely. And a lot of that, like I said, take a breath. Usually in the OR, you have a fraction of a second before you respond, and take a breath and sit for just a second while you're giving meds or while you're taking care of your intubate, whatever it is that's going on. Take a second. And a lot of people, I've worked with a lot of people that they'll lash out, and if you don't rise to them, all of a sudden, oh, I'm so sorry. I'm so sorry. It's like you said, when you start lashing out, they're lashing out, and then it's just an avalanche effect, and nothing's getting done, and nobody's working to the best of their potential. When you have these kind of fight or flight symptoms, we have all of this stress release and cortisol and just so many things going on in our body that you kind of lose that touch of reality for a second. I mean, we all feel it when you get really mad. You just want to say something. And then you, like you said, you think about it. It's probably not the best thing. That's where just take a breath, take a second. Just because somebody says something in the heat of the moment doesn't mean you have to respond immediately. You can take a second. I'm working on it. I've got it. Let me call somebody for a second set of hands. And how you respond is definitely a way to de-escalate the situation. And because the way I see it is, my patient's my number one priority, right? They're my number one, let's say, customer. But so are the nurses I work with, and the circulators, and the doctors, and the pre-op nurses, and the PACU nurses. And my goal is, how can I facilitate this room so that we all work the best together, so that we all can take care of this patient the best, and we can get it done quickly, efficiently, safely. And if I am causing turmoil in the room, that's not going to happen. And then it also gets down to, if I continually cause turmoil, well, I may not have a job left. The facilities may not want me to come back. And anesthesia is a small world too, right? You may not have an ability to get a job elsewhere if you cause turmoil constantly. And some of that is a huge self-reflection of, can I take feedback? Can I look at a situation and say, this was my part in that situation? Maybe, maybe not.
I think the one of the points we're talking about here is social awareness, and it becomes very clear to me when I'm precepting somebody, their orientation to the room, whether they are viewing everything that is surrounding them, or if they are focused on the patient, focused on the procedure, focused on their coworkers. And I think in these conversations that we're talking about too, you can kind of get a picture of, okay, am I responding to this because I'm personally offended, or I personally need to make this right? Or do I need to respond to this because there's a patient issue, or there's something that I need to identify that is for the safety or the betterment of whatever outcome we're working on? And if it's a personal thing, that's something that I can address later. And I could say, hey, that conversation that we had earlier, it felt harsh to me, and I felt like we could have communicated that better in the moment. I'd love to work on that together with you. That's just my perspective, and I wanted to be clear with that so we could clear things up. That's not something that needs to be taken in the moment. Like you said, maybe you're intubating, maybe you're giving meds or all those things. And it's like, my part of the emotional intelligence is dealing with people who are emotionally unintelligent at times, and they're going to say things that are hurtful and harmful, and you want to snap back. But I'm not the center of this situation. The patient's the center of the situation. And so I think part of that social awareness is understanding your orientation to the things around you and keeping the main thing the main thing.
Absolutely. So part of that social awareness is learning, when I say something to you, how do you respond? Does your face change? Does your body language change? Do you completely turn your back on me? Or every time I say something, do you turn away from it? I think that's something that we have, like I said, lacked in the last few years because everybody is so electronically communicating and I mean, I'm not that old. I've been telling everybody I'm 46, but I turned 46 in December, so I get to relive this year. But it's taken a while. I like what you said earlier, Cole. This is not something you're born with. This is something you can absolutely 100% work on and learn. It just takes a little effort. Self-reflection is never easy for anybody. But when you start learning those cues of when I said this, they did this. When I responded this way, they did this. When I responded harshly in the OR, it just tanked and nobody wanted to come help me put in an IV in this prone patient that the arms are tucked or whatever it is. Maybe that's time to say, okay, have I worked to the best of my ability in working with my team? Or is it me, I? When we take care of patients, it's a team effort. It's not me against the world or the surgeon against the world or the circulator. It's us. It's a team. And in doing it as a team, there's times you got to put yourself aside and you redress it later. And that's totally fine. There's times I've done that. I've worked with new nurses and I'm thinking, oh my word, this is going to be horrible. Like I can't get anything done today. And I have to step back and think, okay, maybe they're under pressure to get their room turned over in 5 minutes when the usual turnover time is an hour. I mean, that's a lot of pressure. So giving people some grace, giving people some ability to make mistakes. We're not all perfect. I tell my patients I am perfect. Every one of them goes to sleep. I tell my husband I'm perfect because all my patients go to sleep and he just does not believe me. But it worked. But that's how you have to make the best of some of the situations that we have.
Yeah, I often talk about this where I work and the residents that come through. I often say you need to learn not just anesthesia, but you need to learn how to read the room. And I feel like that is such a missed part of anesthesia. And that's kind of what I was referring to when you first introduced the topic, the idea of how there's staff members that'll be like, oh, I love so-and-so. Like they're one of my favorite CRNAs. And again, I'm like, okay, like I've worked with them. I even trained with them. Like, what is it that they know that I don't know that like makes them such a good CRNA? And I've started to put together this idea. It's not just the anesthesia stuff they know. It's their ability to read a room. And that's why people say, oh, I'm with this person today. I know I'm going to have a great day. Because they know when things arise, that person is able to read the room, figure out the temperament, how to respond. And I think a lot of that goes into not just the social awareness, but also having empathy for other people. It's, again, putting yourself in their shoes, for one, but can you relate with them? Can you see where they're coming from? And oftentimes, even somebody you completely disagree with, if you can see their logic and reasoning to how they got to where they're at and where they're coming from, it then allows you to see it from the different perspective. Even if you're still on the right, it allows you to see the direction that they're coming from and be able to figure out a solution moving forward. So reading the room is huge. And again, I know I said this before, but working on OB, there are so many different environments you walk into with OB, and you have these completely wide awake patients. And when I come in to do a labor epidural at 2 a.m, there's multiple scenarios. And when I open that door, I have to be ready for any scenario I'm going to walk into. You have the mom who does not want to listen to a word I'm talking about with pre-op things and risk and benefits. She just wants pain relief. You have somebody who is extremely nervous about having a needle put in her back and wants to go over every single question. And it's the way that you show yourself and present yourself to that room and those first couple moments that shape the trajectory of how much they trust you before you go put a needle in their back. And so being able to read the room and be able to have that social awareness and then put yourself in the shoes of what that person is experiencing goes a long way. And again, taking you from, I think, an average anesthetist to somebody that people really respect in this field. And you can take great care of your patients and you have this reputation because you know that extra layer of how to read the room and how to provide that better holistic care to that person.
I think that really gives a good segue into your purpose. I think we as nurses being trained, we have a different perspective than our physician counterparts in the fact that I went into nursing because I do care about patients. It's a different perspective. We see it all the time, right? And my goal when I go in to talk to patients is how do I make you feel comfortable in possibly one of the most stressful, one of the most life-changing events that you may ever have? I have 5 minutes to make you comfortable, help you feel at peace, to answer your questions. I do a lot of peds. I have done a lot of peds in my life, and it's how can I make the parents comfortable, right? I get down on the floor. I play with the kids. In fact, I had one family. They're like, "Oh, he's just not. He's going to scream," and I'm used to kids screaming. You can't win them all, right? But I do still say I'm perfect. But you can't win them all. But I had this family, and they're like, he's just going to be awful, and he's just going to scream. And I sat there for probably 5 minutes and played with the kid and just whatever. I think it was 2 or 3. And so when it was time to go, he just climbed up in my arms, and both the parents, like jaws on the floor.
Amazing.
And that's part of that living your purpose, living your, why are we doing what we're doing, right? It's not about putting somebody to sleep. I mean, truly anybody can be taught to put somebody to sleep and do that. To me, what makes us stand apart, and like what you said, the CRNA that the students love, that the staff loves. I mean, I love it when I walk into a room and like, oh, I'm so glad you're here. What makes that difference is how you can interact with your patients, because all of our goal is to make the patients feel good. So how can I make my patients better? How can I make the experience the best of what it can be in that situation? And then how can I work as a team and really make this day a good day? You have to work. You have to have a job. And I mean, most of us, I wish I didn't, but it's life, right? So how do I make my day go the best it could be? And that is working together and figuring out, okay, walking in the room, reading in the room, and you can feel the scrub is throwing things down and the surgeon stomping past the door. And all of a sudden you have the entire OR leadership team in there trying to help and open the cage. That's probably not the best time to be like, hey, can y'all come fix my circuit for me? I can't do it.
Right. Yeah.
It's reading the room, and that makes a huge difference.
It's so funny because again, sometimes I think you think this is intuitive, and sometimes it's not. Like you have people, the other day I was giving a break to somebody, and I was just getting a report, and the CRNA asked for, like literally that same example, like they were asking for something, and you could tell the room was stressed, and I saw the eyes dart over towards us, and I could not get any smaller. I was like, I'm just coming here for a break. But it was, like the only way I can describe it is it feels like they are only aware of their needs and their desires and wants. And when they have something they want or need, they express it. And it's like, you're not appreciating, like we talked about, you don't have that social awareness or the empathy when somebody else is struggling and you don't understand why you're struggling. Okay, you can turn over a room, like you said, for that new nurse is not a big deal. Well, this might be their first day at a new facility. We all know how that feels, and you don't even know where the restroom is, let alone where to find a set of sterile gloves. And so there's a lot of factors that can go into it. And yes, it's something that you feel like should be intuitive, but it's not. And it's something that we can all do better about, trying to have vision beyond just ourselves and paying attention to other people's experiences and what's going on in their daily life. I think what you mentioned, Cole, with having people that are, when they come in the room, and you mentioned that too, Bree, and they say, oh my goodness, I'm so glad I'm with you. I asked somebody said to me, it's probably like 2 months ago, and I asked them, I was like, does it really make big of a difference? I was like, we all put the patient to sleep and we all wake them up. And I was like, does it really affect you guys that much? And they were like, my day it's make or break depending on who's in my room. And it was just really interesting for me to think about, like, I know, and I teach that we control the temperature of the room, but from hearing it from their perspective of just like, my day, I know I'm going to have a good day if I have a good anesthetist up there, and I know I'm going to have a tough day if I don't. And I don't think that's necessarily related to how you intubate. I think that's what we're talking about today, about emotional intelligence.
I was going to say, what do you think? Because a lot of our listeners are currently going through anesthesia school. So, like, what would be your recommendation to apply all this? Because we've talked a lot about, as a CRNA, how you handle things in the operating room. But, like, specifically from the lens of a resident going through school right now, and when people often would talk to me through school, even when I talk to people now that I'm post, graduating anesthesia school, I look back. The hardest part of school for me was not the learning anesthesia. It was the dealing with different personality types in school. Because especially the quote on the job training, you're with a new person every day. Most facilities are, and you're bouncing from facility to facility. You're meeting new people, and sometimes you only get one day interaction with somebody and that's it for your program. Then you have a new personality the next day. And you're just set up from that standpoint, from a social standpoint, for failure if you don't have emotional intelligence. I mean, because you're meeting new people every day and somebody is just watching your every move. And so the hardest part for me, I'd get asked, like, what cases are your most challenging, or what do you dislike the most? And I remember saying in school, I'm like, I don't care what the case it is I'm being assigned. I care more who I'm with that day. Like, that's what makes or breaks my day, is the person that's precepting me and how I can get along with them from a personality standpoint. So I guess specifically dialing into that trajectory, what would be your tips and recommendation after going through what we're going through today from that light?
First of all, for the students, you can make it. You will get there. We've all been there, and it's hard. I think that's probably one of the hardest things. Like you said, the anesthesia is not necessarily the hard part. It's dealing with the personalities day to day. You'll have some personalities that do what you want. Tell me what you want to do and let's do it. Versus the other personalities that I only want it this way and this is the only way you're going to do it. One of the great things that you can do is talk to the other students that are with you. Maybe they've worked with that person. Maybe, hey, give me some tips and tricks, or see if there's other students in the facility where you're at, especially maybe senior students. Hey, I'm working with this person tomorrow, especially it's your first time. What do I need to know? Use the resources you have and really work that way. Be proactive. I hear a lot of times CRNAs don't want to teach students because, well, they haven't called me and they're just flying by the seat of their pants and they think they know what they're doing, but they don't know. Be proactive. Find that CRNA you're with and say, we're had these 3 patients tomorrow. Do you want to go over them tonight or do you want to go over them in the morning? To me, that proactiveness and that willing to work with somebody and say, this is my plan. Is this good with you? What are you thinking? I've had a student one time that she was probably 3 or 4 or 5 months in the program. She goes, well, I think maybe I'll give this. What do you think? And I'm thinking, at this point in your training, you need to know what you need to know. And that was it was kind of off-putting. And it was, you should know this by now. So we had that conversation. And I think that's something on the flip side, as preceptors, we have to have those conversations. It's real hard to give feedback. It's also really hard to receive feedback. So as a student, especially those first few months, be open to whatever feedback you get and take it with whatever you can, right? Feedback is a gift. You can either accept it or you don't. And so especially when I was first out of school, I would ask the pre-op nurses, I would ask the PACU nurses, were they in pain? Were they hurting? Were they this or that? But when you're working with those preceptors, communication, I think, is key. To me as a preceptor, I would rather you over-communicate the first few times I work with you rather than under-communicate. I don't care if you're a senior about to graduate. If I haven't worked with you yet, I don't know your thinking behind things. I don't know where you've trained maybe. So the communication, but like you said, reading the room. If you walk into the room and maybe your preceptor is already there throwing stuff around, maybe they're upset, maybe because they think you're late. Maybe they think you should have been there 2 hours early instead of an hour early. I don't know what it is, but kind of read the room. See if you need to figure out something or if you need to communicate better. And I think as a student, humility is huge and hard work is even bigger. Be willing to put in the hours. Be willing to stay late. Be willing to learn the craft that we are trying to teach and that you are trying to learn. Because when you show that you are invested and you are dedicated to learning this, and it will be reciprocated. And so all of that goes together, right? It's learning your strengths and weaknesses yourself, learning how to read others and interact with others. It's a huge tool and an asset. If you can do that, you will be successful everywhere you go. All of the training and all of the studies show that people that have this high social awareness, the high emotional intelligence, they're happier, they're more optimistic, they're better leaders, they're better coworkers. All of that works together to really, truly, like I said, it helps you take better care of your patients. And when you can take the best care of your patients, your day is a success.
That's so well said. And I think the last thing I wanted to just touch on here before we wrap up is I think one of the tendencies while we're talking about this is to go so far in the other direction that you're constantly monitoring and you're constantly allowing other people's whether it's your problem or not, you're allowing their actions to affect you. And I think it goes all the way back to our initial talk about self-awareness and being confident in yourself, because some people just have bad days and sometimes you're not involved with that at all. And that's a them problem, not a you problem. And that's not something for you to own or for you to take that emotion from them. But I think that as we, go on this journey to be aware and be socially aware, it's not a one size fits all. And some days it's nothing that you can adjust or you can change, and it's nothing that you need to spend extra mental energy on. It's simply maybe that CRNA is storing around that was, supplies because you are late, and that's something you got to own and you got to fix that. And you need to be very aware of the factors at play. Maybe they came in and they really don't like doing peds and they're doing peds today and they're just having a frustrating day. And they're, there's obviously things that you can adjust, and maybe you don't have at length conversations with them on a day that they don't love doing that. But there's some things that are just for them to own and not for you to own. So can you just talk quickly about how maybe where you find that balance of definitely being aware, but then also not owning things that are not yours to own?
Yeah, I love what you said is own it. When I talk to students, I tell them, if you make a mistake, own it. If you do good, own it. You did really good. And having that approach of, I can only fix what I can fix, helps you go into that spiral, especially as a student of, oh no, I did this or what. I can only do what I can do. Did I come prepared? Did I show up when I was supposed to? Did I know what I was supposed to take care of this patient? If I look, this is that self-reflection again. If I did what I was supposed to do, then I came prepared. I own that. If I didn't, well, then I can understand why they're upset. And same thing as preceptors is we should own that too, right? Like he said, maybe you don't like doing peds and you're stuck in peds. Then you're just going to have to deal with it. And that's what it is. And then you have the stress of a student. It is stressful having a student, but you can either choose to have a miserable day and make everybody around you miserable. And then your patients feel that, especially if you're doing, some crazy serious stuff. I mean, we all do stuff, but, brain surgery, open heart surgery is not like a lap chole, right? But if you're doing these already stressful situations and your attitude makes it even more stressful, it's just going to be a miserable day. My goal is when I go into a room is how can I make this day better? And how can I be a positive impact to my patients and those around me? I can only do what I can do. I can't change that. Maybe you had a fight with your spouse or you're dealing with something or you truly don't like your job. In fact, I changed job a number of years ago to kind of go with this is I'm usually a very optimistic person. I like having a positive outlook. I think there's always the bright lining. Do we have bad days? Absolutely. Who doesn't? But I got to the point where in my situation, I could not change my situation. It was a very negative environment and I started being negative and I didn't like that about myself. And it was not only just at work, but then at home and in my kids and my husband. And so I decided since I cannot change that impact or that environment where I'm at, I need to remove myself from that environment and went and worked somewhere else. And eventually I came back when the culture changed and I was happy to come back. But I think, like you said, owning it. I can only own my emotions, my reactions. And if what I'm putting out there is with good intent and good emotion, then that's all I can do. If I'm trying to be negative and tear things down, well, then I need to own that too.
Yeah, that reminds me of something I heard recently, which is you may not be able to change your situation, but you can change how you respond to your situation. That's what you have complete control of. Nobody can take that from you.
100%.
And so it's the way that you respond. And I think that's the essence of what this whole talk is about. So in controlling your own emotions, being able to show empathy to others, being able to respond in appropriate situations, you're going to be a much more well-rounded individual that people want to be around, they want to work with, and you're going to see more positive results for both your patients and also your staff and the environment that you're in. So again, thanks, Bree, for joining us. Again, this will tie in. Stay tuned to our next episode. We're going to bring on Ray Ramos from USAP as well, and we're going to, in a way, piggyback off this conversation as we talk about survival guide going through just your journey as a CRNA and to become a CRNA. And a lot of that stems from the ability to have emotional intelligence and to be able to apply your emotional intelligence to every situation that you're in.
Yes, thank you guys so much. I really appreciate it. I appreciate you taking the time to talk with me. It's been great.
Awesome. Thanks, Bree.